Currently, there are millions of people around the world who suffer from type 2 diabetes and its often debilitating side effects. Unfortunately, for most of these patients, their only recourse has been to treat the symptoms of the disease using medications and by daily monitoring their blood glucose levels. This video was created by Passport Medical and Medical Tours Costa Rica to educate patients about a new metabolic surgical procedure being performed by Dr. Jacobo Safrani and his team. The surgery effectively eliminates the symptoms of type 2 diabetes in the majority of patients who undergo the procedure. The video you're about to see provides an overview of the treatment process at the Joint Commission International Accredited Hospital Facilities in Costa Rica. Upon arriving in San Jose, Costa Rica, you will be met outside of the airport by our English-speaking representative, who will assist you with your luggage and drive you to your hotel. The driver will be identified by a sign with your name on it. In most cases, your first day in Costa Rica will be spent relaxing at your hotel. Costa Rica is a tropical eco-paradise famous for smoldering volcanoes, emerald rainforests, and sun-swept beaches. The country boasts a long democratic tradition and is located just a few-hour flight from many major North American cities. On day 2, you will be transported to the hospital to undergo your preoperative exams and to meet with a surgeon and other doctors involved with your procedure. Preoperative exams for the procedure for type 2 diabetes include comprehensive blood panel, upper endoscopy exam, consultation with an intensive care doctor, electrocardiogram, and assessment with a nutritionist.
Hello, my name is Ricky Scott. I was training to be a pilot until I was diagnosed with type 2 diabetes. Told that I can't fly commercially if I have type 2 diabetes. So I don't like to be told that I can't do something, so I looked on the internet and searched for various facilities and doctors that if there was a way around this problem, and I found that there was a type of surgery available in Costa Rica that I could do that would help out with this. The reason being our country doesn't offer it. Where I'm from in the UK, you can't get this type of surgery. So I decided that after looking into it and looking into a doctor called Dr. Safrani, I decided I'd take the plunge and go for it.
During your time at the hospital, you will be assisted by a multilingual representative who will accompany you to all your tests and appointments. Our medical team will make a detailed evaluation of your condition, answer all your questions, and provide you with post-surgical care and nutritional guidelines. Our representative will also assist you coordinating the purchase of the items for your diet. On day 3, you will be picked up at your hotel by our representative and transported to the hospital for your procedure. In most cases, you already have undergone the pre-admission protocol the day before. So after signing some consent forms, you will be taken to your private air-conditioned hospital room to be prepped for the procedure.
Hello, my name is Jacob Safrani. I'm a general surgeon, advanced laparoscopic surgeon, and weight loss surgery. I work here in Costa Rica. I was born in the United States. I did my med school here in Costa Rica and also my postgraduate on surgery. I have done a lot of courses in United States and South America and Central America for weight loss surgery and metabolic surgery. I'm member of the ASMBS and also the member of the IFSO and the representative for here for Costa Rica for the IFSO Federation. I'm also one of the founders and directors of the first training for laparoscopic surgery here in Central America.
Hello, my name is Jorge Esmeralda. I'm a general surgeon and bariatric surgeon. I'm living in Costa Rica since 12 years long. And I have training in Spain. I did my fellowship in bariatric surgery and metabolic surgery in Spain. And I have done about 2,000 bariatric surgeries at the moment with complication rates below 1%. And I have deeply involved in the treatment of metabolic disorders. And we have done about 80 procedures of diabetic surgeries. And our results until now are very good. And we have been involved in a team, a Latin American team that have been treating this kind of disorders. And we truly believe that this is one of the surgeries that have been changed the problems of the diabetes. Metabolic surgery is the name that we use for the treatment of diabetes type 2 problems. And the studies tell us that the patients under 16 years old are not candidated for them. So the range of age is about 16 to 60 years old. There have been diagnoses of diabetes type 2 in less than 10 years and have been treatment under that time.
And we've seen that when you perform a gastric bypass and you do a bridge or you bypass the first part of the small bowel, these will decrease the insulin resistance that diabetes type 2 has and makes the pancreas produce insulin. And this is how diabetes resolve in a 90% with this kind of surgery. Gastric bypass is for obesity surgery, but what we modify the gastric bypass is for those patients who have their BMI under 35, they don't lose a lot of weight and they can resolve their diabetes and also their high blood pressure and high cholesterol. So with these modifications, we can resolve the diabetes also in a 90% of in all the patients. This means that the modifications that we do are when we do a gastric bypass, we do a very, very small pouch so that people can have restriction on the amount of meal they can eat. But when we do this metabolic surgery, we make a bigger pouch so you don't have a lot of restrictions, so you can eat a very good amount of meals, but also we bypass the first part. Also, when you do a bypass on the small bowel, usually you do a malabsorption part on obesity surgery. But when you do a metabolic surgery, this bypass, it isn't so long, so a malabsorption doesn't exist, but you can skip the first part of the small bowel, and that's how you resolve diabetes type 2.
We've been monitoring my blood sugar levels after the procedure. Just out of my own curiosity, I was going to do it anyway, but also at the request of Dr. Safrani. And they've been dropping fantastically, I have to say. I checked last night, my blood sugar level is now at a level that it hasn't been in 2 years, and that includes a year and a half on medication. It's still not come down to the level it was last night.
Once the procedure is complete, you'll be taken to a recovery room for 1 to 2 hours, and then back to your room for 24-hour monitoring and care by nurses and doctors. You will be discharged from the hospital around 3 p.m. the following day. A driver will escort you back to the hotel to continue your recovery. In most cases, you will leave the hospital with recommended medication for your optimal recovery. Back at the hotel, you'll receive scheduled nursing visits to monitor your recovery. A few days prior to your departure, a driver will bring you for your post-operative consult with a surgeon. A driver will transport you from the hotel to the airport for your return flight home. The metabolic procedure for type 2 diabetes is performed at only Joint Commission International accredited hospital facilities, including SEMA Hospital, Hospital Clínica Bíblica, and Hospital La Católica. Joint Commission International is the highest standard in international healthcare, which certifies over 18,000 hospitals in the United States. As Joint Commission International accredited hospitals, these facilities have achieved the gold standard in international healthcare.
Sort of personal testimony about the whole place. If anyone is looking into getting this type of surgery to help with the type 2 diabetes, I've personally vouched for it. I'm not being paid to sit here in front of a camera and say anything, so I've got it done. I put my money where my mouth is, so I'm very happy.
Passport Medical is a North American medical tourism company that facilitates the contact between patients and medical providers. Passport Medical is a member of the Medical Tourism Association, a body whose aim is to promote the highest level of quality health care to patients in a global environment.